Blowing the whistle on dangerously low staffing levels. That's what the nurses union at Rochester General Hospital says it's doing. News 10 NBC's Haley Higgins joins us from RGH, where the union will release staffing data later this morning. Haley, what's the exact accusation against the hospital?
Well, Lynette, the union is accusing the hospital of failing to meet the safe staffing minimums that they had set forward together in their contracts. Now, the Rochester Union of Nurses and Allied Professionals is called RUNAP, and it covers about 1,000 nurses here. All of their shifts, and they claim that so far this year, there has not been a single 12-hour union shift that was fully, completely staffed from start to finish. Now, that metric and other metrics show a failure to uphold their contract, and so they say RGH now needs to pay a $100,000 fine. The nursing shortage has been a nationwide problem since the start of the COVID-19 pandemic. But let's just look at RGH here. Nurses unionized here in 2022, and they got a contract the following year. The year right before that, the New York nurse staffing law had been passed. That law had been set. Now, the union contract here added some parameters and punishments on top of what was required in that state law. But the union says RGH is not following what it agreed to in that contract. Now, I did get a sneak peek at some of the numbers, and I do want to highlight that some of these shifts on some of these days that were marked understaffed do still hit that state minimum. For example, in the intensive and critical care units, for every one nurse, there can be 2 patients. That's what the state says. But RGH set the bar higher, and they agreed to keep that bar higher with the union. And that is in some of the cases where they are falling short, even if it's still state legal. But the union says that it is bad for patient care and bad for patient safety, and that's why they're calling it dangerous. We, of course, did reach out to management here to hear their response on the numbers being released later today. Management said they're aware of it, but had no further comment to make. Live outside of Rochester General Hospital, Haley Higgins, News 10 NBC today.
Haley, thank you. Before you go, just one quick question. What happens if the hospital gets fined?
So that is a fine from the union contract, and so that's set forward that it would be paid out to the nurses. So if every member in the union gets it, it would be about $100 here at RGH. But that statewide enforcement is a little bit of a different issue. Advocates say that that is a problem statewide. Almost half the hospitals are dealing with a failure of that enforcement for those state minimums. But again, I really want to highlight some of the minimums might be state related and some of the minimums are union contract related. Both are a matter of failing to uphold the rules set forward, though.
All right, Haley, thank you.